Ladies and gentlemen, today we have recorded the highest number of positives cases since we started testing, since our first case. We have today 184 cases that have returned a positive result after testing a sample size of 2,518 over the last 24 hours. The positive cases now push our cumulative numbers to 4,044 out of a total of 124,474 samples that have been tested in the country so far. In terms of gender, 129 of the cases today are males, while 55 are females. And all of them except one are Kenyans. The 184 positive cases are distributed in counties as follows. Nairobi has 111 cases, Mombasa 19, Kajiado 14, Meru 13, Kiambu 9, Busia 6, Nakuru 4, Machakos 3, Kwale, Kisumu, Garissa, Taita Taveta, and Vihiga counties 1 case each. The last county, Vihiga, now becomes the latest county to record a COVID-19 case, bringing the total number of counties so far affected to 40. By sub-counties, the cases are distributed as follows. In Nairobi, there were 33 cases in Westland, 19 in Kibra, 18 in Langata, 15 in Embakasi East, 12 in Dagoretti North, 4 in Kamkunji, 2 in Makadara, 2 in Starehe, 2 in Embakasi Central, Roysambu, Embakasi West, Kasarani, and Embakasi South had 1 case each. In Mombasa, the cases are from Mvita 9, Changamwe 4, Likoni 2, Nyali 2, Jomvu and Kisauni 1 case each. In Kajiado, we have 12 cases from Kajiado Central, Kajiado East and Kajiado North 1 case each. In Meru, the 13 cases are all from Imenti North. And in Kiambu, the 9 cases are from Lari 3, Juja 2, Kabete, Kikuyu, Kiambu Town, and Limuru 1 each. In Busia, all 6 cases are of truck drivers in Malaba and Matayos. 5 in Malaba and 1 in Matayos. In Nakuru, the 4 cases are from Naivasha 3, Nakuru East 1. In Machakos, all 3 cases are from Athi River, while in Kwale, the 1 case is from Lunga Lunga. In Kisumu, the 1 case is from Kisumu Central. In Garissa, the 1 case is from Garissa Township. And in Taita Taveta, 1 case is of a truck driver. In Vihiga, the case is from Vihiga Town. On a positive note, we are glad to report that today we have discharged 27 patients from our various facilities, bringing the total tally of recoveries to 1,353. Sadly true, we have lost 2 more patients to the disease. The total number of fatalities now stands at 107. And again, we express our deepest and heartfelt condolences to the families and friends of the bereaved during this trying moment. Fellow Kenyans, as we have observed, our numbers of positive cases are steadily rising. and it is a matter that we all need to be concerned about. This further confirms that community transmission is now quite well established within the country. As we try to trace and treat, testing becomes a cardinal feature of the strategy of our response. Testing and accuracy of testing will become increasingly important as these numbers continue to rise. And I want to take this opportunity to talk about observations in this area that are concerning us. We have noticed, for instance, that several testing kits that purport to diagnose COVID-19 have permeated our market. I think this is a matter that needs to be addressed, and I want to say a few words about this. First and foremost, the standard test that the ministry uses as a diagnosis of COVID-19 is the real-time PCR test based on detection of nucleic acid of the virus. That is the only test that definitively identifies the presence of coronavirus in those that turn out positive. And I want to tell Kenyans also who are being told that they will be tested for COVID-19 using these 15-minute, very quick assays, rapid test where a puncture is made on your fingertip, a drop of blood is drawn out, put on a cassette, what they call the lateral flow systems, and then you see a band. I think all of you are familiar with the test for malaria. Well, each one of us must have gone through that one time or other. This test for COVID, which works in that fashion, is not the right test. That is not to say that these tests do not have value in terms of telling us something. Indeed, for now, they do have value because they can tell us the level of exposure within a community or within a population. And therefore, they have been authorized for use for purposes of surveillance and research. And in fact, as a ministry, we plan to use some of these tests just to do surveillance so that we get an idea of the level of exposure of coronavirus in our communities. So what I want to state here is that for Kenyans, please do not take those results as of an RDT test for now, giving you the comfort that either you are negative of COVID-19, or in some cases giving you the anguish of telling you that you are COVID positive. The only test that is accepted and the gold standard for COVID-19 right now is the real-time PCR test. Secondly, for those who are vending these tests, we also want to caution them not to misrepresent the utility of these RDTs in diagnosis of COVID-19 disease. Equally, to our own regulatory authorities, we will in the coming days be streamlining the processes of having these tests on the market and determining exactly for what purposes they can be used.
Regarding the total number of patients, as of today, we have 548 patients admitted in various hospitals throughout the country. 5 of them are in critical condition, 3 under ventilatory support, and 2 are getting supplemental oxygen. The rest of the patients are asymptomatic and just being observed. Again, therefore, that means if we are to deploy dexamethasone, because as of now, 88% of our people, of our cases, are asymptomatic, it means this medicine will only apply to a very small fraction of our cases. So, in essence, this is to tell you that there's still no cure for COVID, and therefore we need to continue with the containment measures that were put in place, including the infection prevention control measures of hand washing, respiratory hygiene, use of hand sanitizers, use of masks in public places, physical and social distancing, and of course avoiding overcrowded places. So these still remain the key, even as dexamethasone offers a promise. Again, based on what was here said, remember chloroquine was also like that. We were excited. And when we received the full data sets, the situation changed. So let's wait for the scientists to be able to review the full data sets at the end of the month. Then we can conclusively say that this is a potent arsenal we can be able to deploy against this enemy.